Introduction to Practical AI in Medicine. What is practical AI? Hello and welcome to the course, Top 5 AI Tools Every Doctor Must Know. Let me start by asking a simple question. What is practical AI for doctors? It's not about robots replacing us. It's about using intelligent digital assistants to help us do our job better, faster, and more safely. Practical AI. AI tools designed to assist doctors with routine clinical tasks, not replace them. Examples include taking histories, summarizing clinical cases, drafting prescriptions, generating discharge summaries, even giving second opinions for radiology or diagnosis. The goal is not to depend on AI, but to leverage it like a stethoscope or calculator. Let's bust some myths. AI will replace doctors. Truth: AI will assist doctors, especially in repetitive tasks. AI is only for techies or big hospitals. Truth: many AI tools today are free and usable even in a small clinic. AI will increase medical legal risk. Truth: when used properly, AI helps improve documentation and reduce human error. This course is focused on practical usage. I will walk you through 5 selected tools that you can use starting today. These are ChatGPT, Glass AI, Perplexity.ai, MedPalm 2 Consensus. Each of these tools can save you time, enhance accuracy, and improve patient satisfaction. Top 5 AI tools every doctor must know. In this session, we'll explore the current AI landscape in healthcare. AI is no longer futuristic. It is here and already shaping the way medicine is practiced across the world. Global trends in 2025. AI in medicine is being adopted by primary care clinics, emergency departments, teleradiology setups, large hospitals, and even rural mobile units. The most popular uses in 2025 are clinical documentation, saving 2 to 3 hours day per doctor; radiology support, symptom triage bots; personalized treatment planning; patient education and engagement. AI is being seen more and more as a clinical assistant, not just a fancy app. Real-life global examples. United Kingdom, NHS, uses Autoscribe AI to automatically generate SOAP notes from consultations. India, several private hospitals use Curie.ai for chest X-ray and head CT interpretation. United States, Epic EMR now integrates GPT-based models for summarizing patient records. Rural Africa, AI-powered apps like Ada Health and Babylon AI are used by nurses for triaging without a doctor present. We are overloaded with OPD crowd paperwork, investigations, follow-up, short consultation times. This is where AI helps: drafting discharge summaries, writing medical certificates, generating patient education handouts, getting second opinions on diagnosis, screening radiology reports. This saves time and improves accuracy. How AI is trained. Doctor-friendly. Many of you may wonder, how do these tools know so much? Here's a simple answer. AI tools like ChatGPT or Glass AI are trained on millions of textbooks, journals, clinical case reports, patient interviews, radiology image databases. Then, they are fine-tuned for specific medical use cases. History taking, diagnosis suggestion, prescription generation, radiology findings. In short, they have read more medicine than any one human could, but still need your supervision. Benefits and cautions. What AI can do: save time, 2 to 4 hours daily, reduce human error, standardize care, assist junior doctors or solo practitioners. What it cannot replace: human judgment, physical examination, emotional connection with patient, medical legal accountability. Always verify AI output and document your final decision. Where you fit in. Doctors like you, general practitioners, physicians, pediatricians, surgeons, are now expected to know at least basic AI tools. You don't have to become a coder, you only need to become AI literate. Just like you learn to use a smartphone, EMR, or ultrasound. This course is designed to make it easy. Summary points. AI is already part of medical practice globally. It's being used in clinical documentation, radiology, triage, and treatment planning. You don't need to fear AI. You need to guide it. This course will teach you how to use 5 top AI tools immediately in your practice. In the next module, we'll dive into the first tool, ChatGPT, and how you can use it in your OPD, case writing, and patient explanation. I will show you step-by-step live demos. Get ready to save time, impress your patients, and modernize your clinic. ChatGPT for doctors, your AI assistant in OPD. Welcome, doctors. In this module, we'll explore how you can practically use ChatGPT in your day-to-day clinic. I'll show you how to get started, even if you've never used AI before, and how it can save time and enhance patient care. What is ChatGPT? ChatGPT is an AI language model developed by OpenAI that can understand medical questions, write or summarize clinical notes, translate complex terms into simple explanations, suggest differentials, and much more. It's like having a junior assistant who has read Harrison Robbins and Medscape, but who always needs your supervision. Live Demo 1. Drafting OPD Notes. Use Case 1. Writing a SOAP note for a hypertensive patient. Prompt. Write a SOAP note for a 55-year-old male with controlled hypertension on amlodipine, presenting for routine checkup. ChatGPT output as patient feeling well, no symptoms. O. BP 12882, HR 76 MNN, Labs WNL. A. Controlled essential hypertension. P. Continue amlodipine 5 mg daily. Recheck BP in 1 month. Encourage diet exercise. Time save. 3 minutes per case. You can copy, edit, and paste into EMR file. Live Demo 2. Explaining conditions to patients. Use Case 2. Patient education. Diabetes simplified. Prompt. Explain type 2 diabetes to a 50-year-old patient in simple Hindi. ChatGPT output. Translated. टाइप 2 मधुमेह में शरीर इंसुलिन का सही उपयोग नहीं करता। इससे रक्त में शर्करा बढ़ जाती है। इलाज में आहार, व्यायाम और दवाइयां शामिल हैं। नियमित जांच जरूरी है। You can print this or send via WhatsApp. Saves time, improves compliance, and builds patient trust. Live Demo 3. Clinical decision support. Use Case 3. Suggesting differentials. Prompt. A 30-year-old woman presents with fatigue, pallor, and heavy menstruation. Suggest 3 possible differentials. ChatGPT output: iron deficiency anemia, hypothyroidism, bleeding disorder, for example von Willebrand disease or hemophilia. Helps guide investigations. Great for brainstorming, especially for junior doctors or during busy OPDs. What you must remember: use ChatGPT as an assistant, not as a final authority. Always cross-check with current guidelines. Never input real patient-identifiable data on public platforms. How to use ChatGPT daily. Quick prompts. Task prompt. Write summary. Summarize this case in SOAP format. Translate diagnosis into Hindi Marathi. Certificate. Write fitness certificate for recovered viral fever. Diet advice. Create diabetic-friendly Indian diet plan. How it helps you practically. Speeds up documentation, improves patient understanding, reduces mental fatigue, helps juniors learn better, adds value in rural solo practices. ChatGPT is your new assistant, not your replacement. Try using it during tea break, in between patients, or while making summaries. It may feel strange at first, but within a few days, it becomes your second brain. In the next module, we'll explore another exciting tool, Glass AI, which converts patient symptoms into possible diagnoses and red flags. Glass Health, your symptom to diagnosis AI assistant. Doctors, imagine if a tool could instantly convert symptoms into probable diagnoses, red flags, and clinical suggestions. That's what Glass AI aims to do. Let me show you how this free web-based tool can help in your OPD, especially when you're short on time. What is Glass AI? Developed by Glass Health, free to use on www.glasshealth. Input: free text clinical symptoms or case notes. Output: differential diagnoses, red flags, next steps. Uses LLMs, plus curated medical knowledge. Case 1. Glass AI suggests diagnosis. Scenario: a 32-year-old female presents with fatigue, weight gain, constipation, and dry skin. Prompt entered into Glass AI. 32-YO female with fatigue, weight gain, constipation, dry skin. No fever, HR 60 minutes, BP 122/76. Glass AI output: likely DX, hypothyroidism, differentials, depression, chronic fatigue syndrome. Red flags: bradycardia, anemia. Recommended: TSH, CBC. Consider referring if symptoms persist. Use: instant feedback but likely conditions. Helps plan tests quickly. Case 2. Typing longer clinical notes. Prompt: 40-year-old male with history of smoking presents with cough, weight loss, night sweats for 1 month. Glass AI output: likely DX, tuberculosis, lung cancer, chronic bronchitis. Red flags: hemoptysis, finger clubbing. Recommended: chest X-ray, sputum AFB, CBC, ESR, clinical Pearl. Glass AI doesn't replace you, but helps cover red flag symptoms you might miss in busy clinics. Case 3. Rural doctors, interns, busy OPD. For new MBBS graduates or GPs in rural areas, Glass AI gives fast suggestions. Flagging of important warnings, structured planning of investigations. Interns can use it as a learning tool to build differential diagnosis skills. Tips to use Glass AI efficiently. Do's and don'ts. Write detailed symptoms like you do in OPD. Don't use vague one-liners. Use it for brainstorming, don't fully rely on the output. Always confirm with clinical judgment, don't input patient name or ID. Disclaimer: Glass AI does not give treatment. No prescription advice is included. It does not replace clinician reasoning. You can download PDF, Glass AI prompt examples. Glass AI is like a digital resident doctor who suggests what to consider next. You're still the final decision maker. Try using it with 2 to 3 cases today. You'll be surprised how much clarity it adds in clinical reasoning. Using Consensus AI, your evidence-based research assistant. Objective of this video: to train doctors on how to use Consensus AI, a free AI tool that summarizes real research papers to answer clinical questions and saves time while staying evidence-based. Doctors, we all know how time-consuming it is to search through PubMed or Google Scholar just to find one clear answer. Consensus AI changes that. It reads the research for you and gives you evidence-backed answers in seconds. Let me show you how. What is Consensus AI? Free, browser-based AI tool. Trained on millions of peer-reviewed papers. Gives direct answers with citations. Focuses on scientific consensus, not opinions. For further details, you can visit the website https://consensus.app. Why use Consensus AI in general practice? Saves hours of manual research. Gives clear, reference-backed answers. Summarizes proven treatments, side effects, clinical trials, and more. Keeps you updated without going to journals. Live demo case 1. Omega-3 for heart health. Prompt typed into Consensus. Does omega-3 reduce the risk of heart disease? Consensus AI output. Answer: yes. Multiple meta-analyses support moderate benefit in cardiovascular outcomes. Shows 5+ studies with links. Confidence score. Great for educating patients or backing up your advice with science. Live demo case 2. Intermittent fasting in diabetes. Prompt: is intermittent fasting safe for type 2 diabetics? Consensus AI output. Evidence suggests intermittent fasting may improve insulin sensitivity, but more research is needed. Supervision advised. Links to recent trials and ADA guidelines. Balanced, evidence-based summary use. For patient counseling and second opinion confirmation. Live demo case 3, paracetamol versus ibuprofen in children. Prompt, which is better for fever in children, paracetamol or ibuprofen? Consensus output, both are effective. Ibuprofen may last longer, but paracetamol is safer in most cases. Summary based on Cochrane reviews. Quick glance at comparative efficacy helps guide your choice, especially when explaining to parents. Clinical strengths of Consensus AI feature benefit. Peer-reviewed sources, 100% science-based. Summary with references easy to verify. Search by clinical question saves time. Shows level of confidence, helps in risk-benefit decisions. Practical uses in general medicine. Evidence for supplements, diets, and lifestyle changes. Updated info on drugs, side effects, and off-label use. Counseling patients with difficult questions. Academic research or preparing webinars. Limitations, must know. Limited to published English language literature. Does not replace clinical guidelines. Not ideal for rare disease queries. Not for legal documentation. Before ending this lecture, I will request you to download the PDF of top 10 clinical prompts to use on Consensus AI. As doctors, we want to give advice that is safe, quick, and backed by science. Consensus AI empowers us to do that without wasting time. Start using it once a week to check advice you give often. Evidence is now just one click away. Using Perplexity AI, the smart search engine for doctors. Perplexity AI, your instant clinical research assistant. Objective of this video to introduce Perplexity AI as a powerful alternative to Google search for doctors, giving faster, more structured and cited answers to clinical and academic queries. Google gives us too much noise, too many ads, and too few clear answers. As a doctor, you don't have time for all that. That's where Perplexity AI steps in. A smart AI search engine that gives you direct, cited answers fast. Let's explore how it works. What is Perplexity AI? AI-powered search engine, not chatbot. Gives direct answers with links to sources. Pulls from PubMed, up-to-date, government websites and more. Understands clinical questions in natural language. Website: perplexity.ai. Why should doctors use Perplexity AI? Saves 80% of time compared to Google. Gives clear, referenced answers with confidence. Understands context, even clinical language. Ideal for quick lookups during OPD or presentations. Mobile and desktop versions available. Live demo case 1. Statins in diabetics. Prompt entered. Should statins be used in diabetic patients over 40 years of age? Perplexity AI response: yes. ADA and ACC guidelines recommend statins for all diabetics 40 years old with risk factors. Sources: ADA 2023 guidelines, PubMed link, CDC page. Summary: +5 citations, plus option to explore more, saves you digging through guidelines manually. Live demo case 2. Best antibiotic for pyelonephritis. Prompt: what is the first-line antibiotic for uncomplicated pyelonephritis? Perplexity output: ciprofloxacin or ceftriaxone are commonly used based on IDSA guidelines. Lists source, mentions resistance considerations. One click to view guidelines. Use in OPD/ER where quick evidence matters. Leave demo case 3. Drug interactions check. Prompt: can amlodipine and clarithromycin be taken together? Perplexity answer: not recommended. Clarithromycin inhibits CYP3A4 and may increase amlodipine toxicity. Source: Medscape plus PubMed plus drugs.com. Perfect for cross-checking prescriptions instantly. Strengths of Perplexity AI. Feature and benefit: real-time search with citations. Trusted sources. Clinical language friendly. No need for keywords. Suggests follow-up questions. Improves clarity. Access to PDFs and full text. Helps academic users. Limitations. Must know. Needs internet connection. May pull outdated sources. Always check citation year. Not good for personalized case analysis. Use ChatGPT for that. Not ideal for rare diseases unless asked clearly. Perplexity AI is your new age search partner. Faster than Google, smarter than PubMed, and tailor-made for doctors. Try asking one clinical question daily for the next 7 days. You'll be surprised at how much time you save. MedPalm 2, the doctor-trained AI from Google for medical question answering. Currently, MedPalm 2 is not publicly available as a standalone tool, where you can enter prompts like ChatGPT or Glass AI. It is under restricted access through Google Cloud's MedLM platform and some hospital partnerships, like Mayo Clinic, Apollo Group. Here's what you can do right now. MedLM, MedPalm 2 on Google Cloud. You can read about it here. https://cloud.google.com. Healthcare. API. Docs. MedLM. Note, requires enterprise setup, primarily for hospitals, research groups, or digital health companies. For individual doctors, current status. MedPalm 2 is not yet available for solo practitioners as a simple web app or mobile app like ChatGPT or Perplexity. In short, MedPalm 2, coming soon for broader use. No direct public prompt entry possible yet. Use ChatGPT, Glass AI, Perplexity, or Consensus AI as practical substitutes in your current practice. Objective of this module: to introduce doctors to MedPalm 2, one of the most advanced medical LLMs by Google, designed specifically to understand, reason, and respond to clinical queries with high factual accuracy and safety. Let us check out this video from Google to better understand the facts about MedPalm 2. We believe large language models have the potential to revolutionize healthcare and benefit society. Now, MedPalm is a large language model that we've taken and tuned for the medical domain. Medical question answering has been a research grand challenge for several decades, but to date the progress has been kind of slow. But then, over the course of the last 3 to 4 months, first with MedPalm and MedPalm 2, we have kind of broken through that barrier. Unlike previous versions, MedPalm 2 was able to score 85% on the USMLE medical licensing exam. Yeah, this is immensely exciting because people have been working on medical question answering for over 3 decades. And finally, we are at a stage where we can say that confident, steady AI systems can now at least answer USMLE questions as good as experts. So the way we started with MedPalm 2 was really to take Palm 2, which is Google's most advanced language model, and then adapt it to the medical domain. To train the MedPalm 2 model, we worked with the panel clinicians across the US, the UK, and India. We took a representative set of answers from this panel of clinicians and then tuned the model to produce answers that look more like those answers. And from there, we used this panel of clinicians and their judgments to kind of evaluate whether these models would perform better across a set of human values, including things like low likelihood of medical harm, aligned with scientific consensus, precision, and a lack of bias. One limitation of existing work was that there was no standard way to evaluate a large language model tuned for the medical domain. So we introduced MultiMedQA, which is a benchmark for large language models in the medical domain, which spans consumer research questions, medical exam questions, and also consumer medical questions. To better encode a set of ethical principles and the MedPalm 2 model, what we've done is a bunch of adversarial testing so that we can take the model, test it in scenarios that it might not have been kind of originally intended for, and make sure that its outputs are aligned with our values. We are opening up access to these models through Google Cloud, and we hope to gather feedback from our partners and use that to further improve and refine the models. There's also the notion of capabilities that we need to further add to these models. One aspect that we are very excited about is multimodal, where a model is not only able to understand text, but also interpret your medical record, or understand and interpret your medical images such as your CT scans, or maybe even genomics data, or protein sequence data. So I think the potential is immense. And as long as we do this safely and responsibly, but also boldly, I think we're going to have a lot of impact in the world. There's still a lot of research to be done, but I am very optimistic that we can get there. Doctors, most AI tools are trained on general text. But what if we had an AI trained only on medical knowledge, guidelines, and clinical cases? That's what MedPalm 2 by Google aims to be, a specialist AI, not just a generalist. What is MedPalm 2? Built by Google DeepMind, plus Google Health, fine-tuned specifically on medical exam questions, guidelines, and case scenarios. Excels in reasoning, explanation, and clinical safety, evaluated against USMLE-style exams with doctor-level accuracy, 85%. Key features of MedPalm 2 feature highlight trained on medical datasets. Unlike ChatGPT, MedPalm is domain-specific, can answer clinical vignettes, simulates diagnostic reasoning, emphasizes evidence and safety, trained to avoid hallucinations, transparent answers. It cites reasoning steps like a medical student would. Performance benchmarks, according to Google, 85% plus accuracy on USMLE-style questions, preferred by doctors in blind comparisons with ChatGPT and GPT-4. Lower hallucination rate than most general AI models. Responses judged by clinicians as safe and helpful. How is it different from ChatGPT or Perplexity? Feature MedPalm 2, ChatGPT, Perplexity, AI target domain, medicine only general plus. Some med real-time web search source trust, clinical training mixed training data, web plus PubMed sources, clinical reasoning high, like a doctor. Moderate minimal reasoning use case. Deep diagnostics, exam level Q&A. General prompts, quick lookup, search. Potential future use cases of MedPalm 2. Medical education, exam preparation, concept revision. Clinical decision support for tricky OPD-ER cases. Case discussions in telemedicine. Background research for rare conditions. AI-powered scribe assistant in EMRs. Limitations of MedPalm 2. Not publicly available for free use yet, 2025. Still under testing for integration into hospital systems. No current mobile or public app access. May require API or enterprise access via Google Health. Where can it be used now? Select research collaborations, e.g., Mayo Clinic, Apollo Group, Google's MedLM platform for enterprise trials. Some integration planned for Android Health APIs in future. MedPalm 2 is the closest we've come to a doctor-trained AI. While it's not yet in every clinic, the future is clear. AI tools will soon be trained like residents, supervised like interns, and available 24/7. Keep an eye on MedPalm 2. It's the next big thing in AI for healthcare. Congratulations, doctor. In this short and powerful course, you've learned how to use 5 practical AI tools that can transform your medical practice. ChatGPT for fast OPD notes, discharge summaries, and patient education. Glass AI for accurate differential diagnosis in seconds. Consensus AI to find real, evidence-based answers. Perplexity AI for smart, quick clinical search with citations. MedPalm 2, a glimpse into the future of AI-powered diagnostics. You've seen how these tools can save time, reduce stress, and improve care without needing any technical skills. You're now ready to start using AI confidently in your daily practice. Welcome to the future of smart medicine.